My name's Alana Erickson, and I'm the Communications Specialist for the Winnebago County Health Department. This is a TV show where we're going to walk you through some public health concepts and tell you how it affects residents here in Winnebago County. Today we're going to talk about preparation, and you might know it a little bit more as getting ready for an emergency. Before I go to my guests, though, we're going to jump over to a video created by ready.gov to talk about what preparation is.
Getting yourself and your family prepared in case of an emergency takes less time and effort than you may think. But if a disaster hits your community, having a plan for what to do and stocking up on some basic supplies can make all the difference in how safely and comfortably you make it through the crisis.
In case of a major emergency, if you call 911, we may not be able to come out as quickly as you'd like us because we're going to be overwhelmed. We're going to have so many different situations at hand. So if you are prepared at home and you have a plan, then you'll be able to cope with it until help arrives.
In an emergency, everything goes out the window. Your emotions, the fear factor, confusion. If everybody's aware of the plan and can execute the plan, that increases your survivability.
Take a few minutes to check out the tips and tools available on ready.gov that make getting prepared easy. There are a few basics. First, learn about the types of risks that could affect your area. No matter where you live, there is a natural or man-made disaster that could strike without warning. Knowing what to do before, during, and after these types of events ahead of time will help you make an effective plan. Then, take a moment to sit with your family and decide how you will get in contact with each other, where you will go, and what you will do in the event of an emergency.
Having a plan that everyone in the family is aware of can be very helpful in those situations where the family members are not in the same place.
You can use the Family Emergency Plan available on ready.gov to organize family information and help you develop a plan that works for you. Identify someone locally and someone out of state who will be your contact person in case of an emergency. And learn how to send updates via text messaging to your friends and family.
One of the things that we've noticed in the past during major emergencies, both the regular phone lines as well as the cell phone lines were overwhelmed. But people were still able to text message vital pieces of information in terms of location, nature of problem, or just to text to say all is well.
Once you've established your plan, print out a list available on ready.gov and start to put together an emergency kit. A standard emergency kit includes water, food, and medicine to sustain all members of your household for at least 3 days. Visit ready.gov for a complete list of suggested items, along with recommendations for how to prepare a family emergency plan. Even if you just add a few items at a time, very quickly you will have a great kit that will ensure you and your family are prepared for an emergency. Also, be sure to keep a copy of the emergency plan together with copies of important documents like birth certificates, insurance policies, and financial forms in your emergency supply kit. And don't forget to maintain your kit and plan throughout the year, replacing items prior to their expiration and keeping contact information current.
Remember that emergency preparedness is not something you can do once and forget about it. Make sure that you review your kit periodically, you update any medication or food and supplies, and also that you periodically review it with your family.
Inquire about emergency plans at places where your family spends time, like work, school, faith organizations, and recreational activities. Finally, get to know the local resources available in your community. Ready.gov can link you to local emergency information and contact numbers, information about sheltering and evacuation, and how to get local alerts and warnings. We can't predict where or when the next disaster will happen, but we do know that when the time comes, individuals and families who have taken even a few steps to prepare themselves will feel more confident and secure in their ability to get through it. Check out the information on ready.gov and get started today.
Welcome back. So now that you know a little bit about preparedness and what it is, we have some staff here from Winnebago County. We have Linda Coleman from the Emergency Management. She's the director and have been for quite a few years. How many years?
Been with the county for over 20 years, but emergency management about 14 years now.
Okay, so she knows her stuff. And then we have Anna Carpenter, who's new to her role, but she's the preparedness special with the health department. So first of all, I want Linda, you to tell us a little bit about emergency management and what the 4 phases of it are.
I think most people would be familiar with emergency management when you talk about tornado sirens, because we are the agency that does those noon tests on Saturdays, April through October. But what we really also do is provide a structure for anticipating and dealing with disasters. So we work with first responder agencies when it comes to disaster planning, and we also work with the public in preparedness. There are 4 stages to emergency management, 4 phases, I should say, and one of them is mitigation. That is taking action to reduce the effect of a disaster. For people for the public, that would be have an emergency preparedness kit. For public sector or government, it's having plans in place and that can help reduce the effects of a tornado to a community or a response to a tornado to a community. Talking about response, taking action to effectively contain or resolve a crisis or emergency. So the Winnebago County Emergency Management Office is also in charge of an emergency operations center that is located at the Sheriff's Office. So when we respond, we open up an emergency operations center. If we have flooding or a tornado, we work with the Red Cross in opening up a shelter for residents, or severe weather monitoring and siren activation. So that's what response is. Preparedness is getting first responders and my agency prepared, and especially the public. What steps can you do to be prepared to handle a disaster if it impacts you and your family? And then recovery, it's assisting the public in the recovery process. If you were a resident in Oshkosh in 2008, you might recall the flooding that occurred here. We had a lot of residents who were still impacted by the flooding after FEMA left town. So we created a long-term recovery group. We bring in resources, United Way, 211, and those are the types of agencies then that help the public recover once disaster and the response from FEMA is done.
Okay, well, that was a good overview of emergency management. Here in Winnebago County, what are some of the top hazards that we deal with?
We have a hazard mitigation plan, and what that does is help us identify what those disasters are most likely to occur. I think if I'd had to ask you, what do you think is most likely, what would you say?
Weather?
Mm-hmm. Weather, yes. Mm-hmm. High wind events are most likely disaster that we would have here. That would include a tornado, and if you've lived in Oshkosh, you're familiar with the high wind events that we've had over the years. Also hail, flooding. We haven't had a lot of blizzards in the recent past, but winter weather also can impact us. Okay. So those are the things that we plan for normally.
All right, so Anna, how does your role come in? How does preparedness and public health overlap?
Yeah, so preparedness and public health work together really nicely, I think, in general. And so when we talk about preparedness in public health, we're really consistently looking at the general services that public health provides. So looking at monitoring and controlling communicable diseases and maintaining environmental health and safety while also promoting community health in our community and area surrounding, as well as working to prevent diseases too. So having that connection for preparedness is very, very similar.
So how do you work with other departments within Winnebago County and help them get ready, help staff get ready?
Mm-hmm. So we work a lot in our department with our staff. So we have nurses and environmental health specialists, health educators, dietitians, and working specifically and a lot more lately on staff training and making sure that our staff are prepared and trained in the incident command system, which is a nationally known and recognized system of working in disasters and with preparedness. So having our staff familiar with that, because other agencies that are involved in disasters and management also are using that same system, and so then the terminology is the same throughout.
Yeah, that's definitely a big change that I can tell as your role is ramped up. She's getting everybody on the same page, the same terms we're supposed to go with. Not always as fun to go through those scenarios ahead of time, but definitely helpful to be prepared.
Absolutely.
So back to you, Linda. Why is preparedness important for Winnebago County residents?
If a resident is prepared, that actually frees up time for the first responders to allocate their resources to other areas. It's so important that residents are prepared to help their own family and to make a plan. And government will be there to a certain point, but there are limited resources. As you know, we only have so many employees and so many officers that can come and assist. So if you're prepared, it just eases up the response for other agencies, that other people that may need the assistance more.
And you brought some examples of how they can do that,
Yes.
right?
As we talked about the tornado siren earlier, the tornado siren is really for people who are outdoors, and I think people in the community they think they should hear it in their homes. No, the tornado siren is for people who are at parks or whatever. It's very important that every resident have a NOAA weather radio. If you have this in your bedroom at night and you have a severe weather warning, this will wake you up if your weather radio is on. If you have a severe thunderstorm warning, a watch, or a tornado. So important. I know a lot of cell phones now have apps on them as well. If you have an updated cell phone, you will automatically receive an alert from FEMA. If you're familiar with the Amber Alerts that come over your phones now, the same thing will happen as if you're in a tornado warning. It hasn't happened here in a couple of years, but I think some people will be surprised. So definitely get a NOAA weather radio. Many of your local retailers sell them, and we also have them available at the Sheriff's Office Monday through Friday if you're interested in purchasing one.
Okay.
So the tornado sirens, again, we went over that. We also have a residential guide to emergency preparedness. There's so many great tips on here for what to do during a chemical emergency, disease outbreaks, severe weather, heat safety. You can pick these brochures up at the Winnebago County Courthouse, and the county clerk's office has them. I believe your office has them as well. You can always call emergency management. But we also have a program, an Alert Sense program, that you can self-register your cell phone to receive other alerts besides tornado warnings and Amber Alerts. Check us out on the county website, the emergency management page. Get Notified is what you'll want to click on, and you can receive emergency text messages if you need to evacuate in your area or if there's a situation going on.
Great. Well, it sounds like you guys are doing a lot of things ahead of time, and actually we prepared a video together for those of you that are getting ready for flood season. Let's hope we don't have to worry about this, but here's a short clip that we put together with the emergency management on flood preparation in Winnebago County. Hello, my name is Alana Erickson, and I'm the communication specialist with the Winnebago County Health Department. I'm here with Linda Coleman and Bernie Sorensen, both the director and the deputy director of the Winnebago County Emergency System. So we're here today to talk a little bit about emergency preparation, which we learned a lot of lessons from the 2008 flood where Winnebago County received over 12 inches of rain in just 8 days. Linda, can you give us a little recap about the damage that happened during that time?
You bet. During that flooding period, we had about 4,000 structures in Winnebago County that sustained a little bit to destroyed damage due to the floods. 75% of those structures were in Oshkosh, but we had about 29 million in damages that were reported in, and FEMA helped about 1,600 families and paid about $4 million out in personal property and reimbursed them for some of their damages. Obviously, 25 million had to come out of the homeowners' pockets or insurance.
So obviously a major event that affected not only the government structure here in Winnebago, but individuals. So
Yes.
how could have we prepared better, and what are things that people should be doing on a routine basis to make sure that we're ready next time something like this comes along?
I think we need to focus, number one, on before the event occurs, because if you're waiting for the event to happen and trying to fix it at the time or after the fact, it's going to be more expensive and it's going to be more damaging personally, financially, and the stress is going to be unbelievable. So you have to focus on the mitigation, the things you can do to lessen the risk, lessen the damages ahead of time. You can do that 3 ways: the outside actions, inside actions, and your insurance coverage. So if you're looking at outside actions, I think you need to look outside. Focus on your gutters, things like your gutters, your downspouts. Make sure the water's getting away from your house, that you're doing the regular maintenance of cleaning your gutters, making sure they don't get plugged up so the water's just pouring over your downspouts, over your gutters, and right down your foundation walls. You need to do that at least, I do it in the fall, and I think everybody should do that. You should look at things like gutter guards, just the simple things that snap in your gutters to keep the debris out of your gutters from plugging up.
You say you do that in the fall, so this should be done yearly?
I think at least yearly. Other things outside, like your landscaping, your grading, making sure you don't have dirt up against your house and plants up against your house that hold moisture. Your foundation cracks in your walls, in the patios that are next to your foundation walls. Those are things on the outside. Inside, you're looking at flooding, you need to look at your sump pump. The pumps in the pits in your basin, if you have a basement, and making sure that those aren't too old. You know, if they're 7 to 10 years old, you need to look at go ahead and replacing them ahead of time. You need to look at a battery backup, maybe even a dual pump, to have two pumps, one that takes over when the other one can't keep up or the other one fails. You need to look at sewer backup if you're on sanitary sewer or city sewer, because if you're in a low spot in your neighborhood, the power fails, the lift stations that carry the stuff away from your house, if it fails and it flows back into your house, if you don't have what they call a backwater valve or a check valve that would stop that flow from pouring back into your downstairs toilets and sinks, you get a major mess. Like raising your appliances inside your house 6 to 12 inches, your hot water heater, your furnace. Basements are generally the problem spots. But if you're living on a first level and you don't have a basement, but you're in a low area, in a floodplain area, you could have the same things happen on your first level of your house.
A lot of people put valuables on basement floors. If you can just put those up on shelves, whether they're mementos or pictures or whatever, just make sure they're elevated.
And the final thing is probably insurance. And insurance is the catch-all at the end. You want to make sure you have that. You want to do these other things first so you don't have to worry about insurance, but you need to go talk to your insurance specialist and determine whether or not you have adequate coverage for those things that we talked about. Either water coming into your home from your foundation walls, coming through your sump because of a failure, power outage, or it just can't keep up, or through Blackwater, sanitary sewer, where it comes back into your toilets and sinks and floods your house with sewage. Those are three different things that you need to talk to your specialist about that, because you can't get it after the fact. You have to get it beforehand. And for renters need to investigate these things from their landlord before they rent a place.
And you had said too that a big takeaway from 2008 was that people weren't knowing the difference in insurance.
Correct. People who had sewer backing up in their basement didn't have that coverage, and flood insurance doesn't pay for sewer backup. We also had people that did have sewer backup insurance, but it was water that was coming down their basement steps or through their windows, so the sewer backup did not pay for that. So having more coverage is important. Floodsmart.gov is a great website for information. Also then talk to your agent, like Bernie said, and tell them what you're looking for, and they'll give you some great advice.
Great. Well, I think we covered a lot of things that people don't think of on the regular basis. As Linda said, floodsmart.gov is a great resource to check out. Or you can find some other resources that we'll post off of our website, and I've put that up on the screen for you there. Well, thank you guys so much for taking the time to explain this a little more, and we'll go back to the studio. Welcome back. My name's Alana Erickson with the Winnebago County Health Department, and now we're going to catch you up on what Rethink has been up to. Today I have here with me Dan Hinton, part of Rethink's Leadership Council, and Emily Deringer. She is the Rethink Coalition Coordinator. So we're going to start with Dan. Can you just give us a little recap about Rethink, how it stemmed, a little history about it?
Sure. It's a long history, actually. It starts way back in 1992 with the Tobacco Free Coalition, and then moved into the Drug Free Communities grant in 08, I think it was.
Yep.
So we got this big Drug Free Communities grant, and then started to make a bigger organization that was broader, started to branch out into substance abuse prevention. It was the biggest change, I think, there. And then, 2011 shifted again to include the CHIP, the Community Health Improvement Plan, and make that a part of the planning and broaden off into the other areas that CHIP was involved with healthy living and obesity and those kind of areas too.
Okay, so as it expanded and got a little bit more involved, it started to take on a structure. And can you explain a little bit of that for us?
Sure, it's a big structure. There's the leadership group is kind of an overseeing group to kind of keep everything communicating well and bounce ideas off of. But there's teams then to work on different project areas, and the project areas now come out of community input. So that collaborative work is really a huge issue for Rethink now, is much more responsive to community input than ever before. It was driven by grant dollars prior, and now it's much more by needs of the community.
Yeah, and that's the really neat part about Rethink, is that community members can be a part of it. It's not just, you know, people that do this for their job kind of a thing, but
So
all
who is
groups.
involved?
Well, there's a great deal of organizations involved, but also just community members too. We have folks that are retired and involved as volunteers. Other folks are on other boards, but also nonprofits, a great deal of nonprofit organizations, law enforcement, some clergy. The folks that are involved are interested in the ideas that Rethink is invested in, the health and community activities.
Yeah.
So.
And what has the focus up until now kind of been? I mean, you've had your focus areas of Rethink. What are those that people are working on?
Well, they're really kind of driven by CHIP, aren't they?
Yeah,
The CHIP
so I mean,
program.
the biggest ones are, like Dan said, tobacco and, you know, drug prevention, alcohol and drug prevention, but also mental health has been, our work in mental health has really expanded over the last couple of years, mostly because of community need and desire to work on improving access to mental health services and other things related to mental health. But then also some of that obesity prevention work, like working on physical activity, making it easier for people to walk, be active, and making it easier for people to get access to healthy foods, fruits and vegetables, those kinds of things. So all the different aspects of what people think is healthy, that's what Rethink is all about.
Great. Well, that's a little 101. What can you tell us some of your big accomplishments that you guys have done over the past few years?
Well, it started off with tobacco way long ago when the first efforts were around restaurants. It's hard to imagine now going into a restaurant where there might be smoke, but that was a thing that was still around in the early 90s. So that shifted, and also into some of the other projects that we've moved into. The Youth Risk Behavior Survey, we got that involved in all the schools in Winnebago County, and concurrently. So we got all the data from the schools at the same time throughout the county, which had never been done before.
Right.
That was really an accomplishment.
Yeah, and that data really helps us take that community input and see if, you know, are our efforts making a difference, especially when it comes to youth, substance use, or in this example, mental health. One of the biggest drivers of why we wanted to work on mental health was because we were seeing no change and actually an increase in students reporting that they were, you know, sad or depressed a lot of the time. So that data is super important.
Sure. The Mental Health Share Shop was formed out of that effort to move into the mental health arena, looking at what services were available, where were the gaps. The community wellness screen for students kind of came out of that then too. So we had this ability to screen students in schools and refer them on to services that were available to them. Get counselors right in the school if we needed to do that.
Yeah, and the Heroin Task Force for Winnebago County is another kind of, it started, infancy was in Rethink, and it's expanded into completely its own coalition, its own work, and is just as big as Rethink now. But the Heroin Task Force, and one of the keynote kind of features of something that anybody would have probably seen is the Rethink Addiction Run.
Right. Big in that yet. Still, that's a major effort for Rethink.
Yeah, and the funds raised from that go back into the Heroin Task Force and back into supporting work that Rethink does. So that's one of kind of our signature things, I guess.
I think so.
That's very visible in the community.
Yeah. Some of the newer things have to do with food, though, where we're getting foods from farm to school program, where we're getting the local districts purchasing from farms, getting it into the schools, having taste tests for the students.
Yeah,
having
and
a great
school
time
gardens too. That's
right, school gardens.
When you drive past school or walk past, hopefully you walk past school, you'll see those raised beds, and we help do those. Or we think our community members help put those together, along with Growing Oshkosh, of course.
Right. Another area that's been with retail then too, though, trying to get the menus to be listed as this is a good meal for kids, this is a good meal for people, healthy plate. Smart plate, I'm sorry, they call it smart plate.
Yeah.
To get those those foods, fresh foods into the restaurants and mark them for the people that are purchasing.
Yeah.
So they know it's going to be a good one.
Right, and then one thing that's near and dear to me, been my baby for the last couple of years, but our Winnebago County Bicycle Pedestrian Plan, it's a rural plan that covers the parts of the county that aren't already covered by an existing bicycle pedestrian plan, so we're really, really excited to see where the implementation of that goes to make it easier for people to get around by biking or walking, so increasing physical activity opportunities. We're really excited about that.
That is a great one.
Well, I mean, you guys have just given us a taste of some of the stuff that you've accomplished. It's obvious that Rethink has done so much for the community, and you continue to do so. But you kind of are changing gears and reevaluating. Tell us a little bit about that. We got a little time left.
Yeah, so like Dan said, a lot of Rethink's, what we work on is driven by community and what the community wants to work on. So we asked what are some of the problems. And we've identified some of those problems, and we're hoping that we can get a lot of folks together in the next couple weeks here or depending on when you watch this, it might have already happened, but you can still join. It's okay to get involved with Rethink. So we're going to be having 2 launch events, I guess, and the graphics up on the screen here. So they're on Tuesday, the 28th of February at 5 p.m. at the Oshkosh YMCA, the 20th Avenue location. Or if you're up in the northern part of the county, we're having another one. Same thing, you don't have to go to both. On Thursday, the 2nd of March at 10 a.m. at St. Mark's Lutheran Church. So we'll have some conversations, kind of present again what Rethink is, what Rethink does, and then we'll have some conversations and get planning on what kind of solutions can we come up with to address some of these problems in the community to improve health.
Yeah, this is really a way for citizens to get involved in some change, real meaningful change that they'll be able to see.
Okay.
Yeah.
And are you looking for other folks to be involved in leadership or long-term, or is this just a one-stop, come and give your opinion?
It could be both. I mean, ideally, we want people to be there for kind of the long haul. At least a year or 2 would be awesome. But if you're there and you can only commit a little bit, we'll take your little bit. So the strength in Rethink is the community connections we have and all the people that are involved. So
great. Well, I know you guys will continue to do good work. You can find more information about that at www.rethinkwinnebago.org. You can also find them on the web through social media channels like Twitter and Facebook. Well, thank you guys for stopping in today. It's great to catch up and hear what you've been up to.
You bet.
Again, this is the Winnebago County Health Department's TV show where we're talking about public health and how it affects residents here in Winnebago. You can catch us online at www.winnebagopublichealth.org or on social media at Facebook and Twitter. Thank you.